Welcome, dear viewers. Glad to have you with us on the Health Television. Our topic today is hay fever, and I recently heard that I believe every third person is now affected, and the number of those affected is increasing year by year. So we are looking for solutions, and I am therefore looking forward to my guests today who can tell me more about it, especially a patient. I may ask how she dealt with the hay fever or how she found the solution. And I look forward to my guests, the Biomed Center Sonnenberg in Schwelbrunn. Both work there, but indeed one guest of today's conversation was also a patient at the same time. I am now looking forward to hearing about the solution. Maybe it's also something for you if you're affected. So stay tuned. We'll start shortly. So welcome. Nice to have you both here. Rochelle Scholar, you are a medical practice assistant at the Biomed Center Sonnenberg and are therefore active there.
Center Sonnenberg. Und also bist also tätig dort.
No, I'll ask that right away. First, I have to introduce Dr. Jürgen Strein. You are also working at the Biomed Center Sonnenberg as a specialist in general medicine, but you also have expertise in biological cancer therapy, orthomolecular medicine, phytotherapy, neural therapy, and dark field microscopy, also a very interesting one.
Und Dunkelfeldmikroskopie, auch ein ganz interessantes Thema.
So we will come to Rochelle in a moment. Maybe I can just interview you again about it. First, what is the focus of the Biomed Center?
Das Biomed Center.
I always want to say clinic.
Thank you very much for having me here. So the spectrum of the Biomed Center in Schwelbrunn primarily includes natural healing methods.
In erster Linie natürliche Heilverfahren.
That's quite a lot. So orthomolecular medicine, hypertension, hypothermia, magnetotherapy, PAPIMI, infusion therapy, neural therapy we also like to do, diagnostics we use. The dark field also quite often.
Nutzen wir das Dunkelfeld auch des Öfteren.
So it's a wide range of natural diagnostic and healing methods that we offer.
I've also heard about hypnosis.
Exactly. Hypnosis has just been newly established. So we are very happy. We have also achieved very high patient satisfaction with it. So we often have cases where patients have difficulties with conventional methods.
Therapie, dass die Patienten da Schwierigkeiten haben.
So they need psychotherapeutic treatment.
Psychotherapeutischer Behandlung.
That's when our Alexandra Kothaus comes into play, who is also a psychiatrist from home. She offers hypnosis and many related additional methods.
Verwandte Zusatzverfahren an.
In addition, we also cooperate with a hypnotherapist from Herisau, Claudia Nüffler, in order to handle the demand at all.
Nüffler zusammen, also den Bedarf, dass wir den überhaupt abarbeiten können.
Okay, so it sounds like there's a lot of interest on the one hand, and it also sounds beautiful that you're trying to use little to no chemistry at all.
Einfach versucht, wenig bis gar keine Chemie wahrscheinlich zu verwenden.
Yes. So it sounds like you're really operating naturally at the Biomed Center Sonnenberg.
Wirklich ganz natürlich tätig seid.
So really everything that our body naturally needs and what our body might naturally do on its own, like hypothermia, for example.
So eine Hyperthermie zum Beispiel.
And sometimes dealing little with what we normally know from a conventional medical practice. The patient comes with a symptom and then gets something to suppress the symptom. Usually the cause is searched for. Is it the case that you really also say, if I don't look for the cause, then I've probably missed my goal?
Dann habe ich mein Ziel verfehlt wahrscheinlich.
Yes, so the cause must be sought in any case, but it may indeed already be necessary that the patient still continues to take his previous allopathic medication.
Trotzdem noch weiternimmt.
Okay.
That with the body first offers an alternative, brings the body first into the situation that the allopathic medications can be tapered off slowly. So we also don't recommend stopping allopathic medications immediately. It can often also be dangerous to simply pause them immediately.
We'll be right back, dear viewers. But you will now see a short trailer, a spot from a very special show that has moved me very emotionally. And if it touches you just as much and you think you must see this program, then please go into the description on YouTube and click on the corresponding link. Have fun.
It is high time to talk about it. Along the intestine, we have the largest amount of immune cells. About 85% of our immune cells are there. This means that if I fundamentally change the structure of the food to products that have played no role in evolution so far, I naturally also change the offerings for the microbiome.
Ändere ich natürlich auch das Angebot für das Mikrobiom.
And I change the composition of the microbiome. The change in the composition of the microbiome has health consequences again.
Hat wieder gesundheitliche Folgen.
And then we should not be surprised that the diseases of the gastrointestinal tract of the entire digestive system have increased massively.
Zugenommen haben.
Ideally, you do this in collaboration with your own therapist or doctor, so that when the situation has progressed far enough, you can phase out the allopathic medication and then you phase it out.
Medikament auszuschleichen, dass man das dann eben ausschleicht.
How willing are the doctors you work with to cooperate? So the patient's general practitioners, let's say, or the attending physicians.
Some are very open. The reactions are very different. Some don't want to hear about it at all, but there are also very open ones who also practice naturopathy themselves, and they are willing to cooperate.
That's very nice. I've also heard that when someone comes to you for therapy, a certain amount of initiative is required on the part of the patient, such as with dietary changes, right?
Yes, exactly. So ideally, with foreign patients, for example, we always prefer it before they come to us, because we only have a limited time, 1 week, 2 weeks, or maybe even 3 weeks, that we don't have time for dietary changes, but rather that we can treat them specifically right away. Ideally, the patients are already adjusted to the plant-based diet, ideally already for 2 months, so that we can start right away.
Bereits schon 2 Monate, also dass wir dann gleich starten können.
Okay. Well, then let's happily move on to the main focus of our conversation. And I will move on to you now, Rochelle, if I may. Hay fever is our main topic. I assume you were affected.
Yes, exactly.
How severely and to what extent?
So it actually started with me early on in 2004. And there I first only noticed itchy eyes. But then it got worse and worse with a runny nose, constant sneezing. On some days, it was even so bad that I developed a severe cough reflex and then had trouble breathing. Exactly.
That can, if left untreated, also develop into bronchitis, or can you say it like that? Asthma? Asthma, yes, thank you. Was that in what context? Can you pinpoint it in any way? Did you move? Were you then in a different place? Or did it just occur more or less overnight? Gradually?
Yes, it didn't occur gradually. I grew up in a small village, very rural, where there are, of course, many meadows with flowers, yes, and trees, exactly. And I'm also allergic to grasses. In that sense, I actually had in spring always the beginning, until actually the end of summer, August.
Yes, I was affected myself. I can relate to that well. And the itchy eyes, I know that. And runny nose, sleeping poorly at night because the nose is either constantly blocked or constantly running. And also when it settles in the lungs and you almost have to deal with asthma. So I know it. Did this illness or these symptoms lead you to Biomed Center, or were you already working there?
Well, since I got hay fever at 14, I was still in school then. And later I was also working with a general practitioner and initially took conventional medical medication. Yes, but a lot of course, tablets, nasal spray, eye drops, and already had some mild success.
So probably an antihistamine then, right? Exactly.
Yes, and then I heard this spring from a colleague at work, as well as from a patient, that they did this neural therapy at the Biomed clinic and raved about it very successfully. So I thought, yes, I'll try to and turn to Jürgen.
Yes, just briefly, because maybe someone who is not affected by hay fever, the side effects of the typical antihistamine and nose drops, maybe we should briefly address that too. So I don't know about you, but I always felt extremely tired afterwards. So the eyes were heavy. How was it for you?
Yes, it was really very exhausting. I was always tired, and the problem was, if I didn't have the nasal spray or the eye drops with me, I was just totally at a loss.
Yes, right. Yes, you already hinted. You then came to the Biomed Center. Then they immediately started with, since you already mentioned it, the neurotherapy. Did they start immediately with that for you? Or how did it go?
So at first I was with Jürgen, and then he took the anamnesis, noted everything well, and then he said, yes, that's good, we can try it with the neurotherapy. And then he simply punctured several spots here on the face and also the lung points, so that he also dealt more with the breathing.
So what should I imagine under neural therapy? May I ask you about that? How does it proceed? Or rather, what is it? What does it do?
So neurotherapy can be imagined like acupuncture. Imagine, exactly, they often use the same points that we puncture, but this is carried out with a syringe and at least a local anesthetic like procaine or lidocaine is additionally administered to have an additional enhancement of the effect. The stimulus alone from the needle creates a stimulus in the tissue, and a reaction follows the stimulus. We already know this from acupuncture. And now we also have the possibility, through the effect of the local anesthetic, to directly affect sympathetic nerve fibers. And in the best case, you can even perforate neurons, that is, the memory. For example, there is a pain memory in patients who have pain, and it can happen that after treatment, the pain is gone. So, as a phenomenon of seconds, which is not very common, but it does occur occasionally.
And what happens then specifically with hay fever or pollen allergy? What kind of memory is erased then? Or isn't it about erasing something like a pain memory or something like that?
It's also about, for example, conducting a therapy in the environment, so to speak. Well, the procaine itself is basic, and it also makes its surroundings alkaline. And thus you have an additional effect because we ultimately do a local environmental therapy as well. Ideally, the whole thing is combined with a change in diet. Ideally, in the case of hay fever, it is the complete avoidance of cow's milk proteins.
Okay. How was it for you? Did you consume cow's milk proteins before, for example?
Yes, but not cow's milk itself. I had already switched early on to soy mix and oat mix, but I also occasionally had a yogurt or cottage cheese for breakfast. And yes, I left that out during this time. I knew beforehand that this could trigger or strengthen allergies.
Neurotherapy, and I hear injections. Was that painful?
Yes, it was actually okay. So Jürgen actually guided me to inhale and then inject. During this time, I had to exhale at the same time. And so I could actually breathe away the pain, I would say. Exactly.
And how many treatments did you need?
So first was the initial treatment, and then we had a follow-up appointment after a week, and then had to repeat the neurotherapy. Und dann mussten wir die Neuraltherapie wiederholen. I was symptom-free for 3 days at first, but then I had slight itching in my eyes again. So we did a second series with injections. And afterwards, it was like this. After 2 weeks, I had the next appointment, and there I had no complaints. So we paused there. And then 5 weeks later, in August already, I started in June. In August, we had another consultation, and there we had once more. Und dort hatten wir noch einmal. Exactly. Repeated the injections.
That's relatively little effort.
Exactly.
Muss man da dann...
Is it important when you do it? Is it important to do it at a time when the allergy symptoms are really present? Or can you say, in winter I'm at ease and now I'll do it in winter?
It makes sense to start the therapy just when the first symptoms become noticeable.
And then you probably see whether it gets better, because if I do it in the winter, then I don't know if I don't have an allergen at that moment. Then I don't know whether I still react and whether I need anything further. Or that's why it makes sense to do it during the symptomatic period. Yes, exactly. How do you say it? A desensitization. I think you should, as much as possible, start early or preferably in the phases when it is not yet symptomatic.
Yes, so we actually still have a lot of room for maneuver with her. So we have now worked purely with neurotherapy, also the lung points, trigeminal points on the face. So these are nerve exit points of the cranial nerve, the trigeminal nerve. It is a very rewarding treatment for the therapist. The points are very straightforward. For starters, it's not quite ideal to do the first neurotherapy right on the facial area. It's somewhat comparable to the pain from the dentist's injection when he applies the anesthesia for the tooth. So it's not particularly pleasant, but since she's a full fracture case, we could start this way. So that was also, you tolerated it well, and we also then saw immediately how the therapy proceeds. We once did the lung points and then paravertebral right next to the spine during the first session as well.
Next to the spine. Aha, okay.
Okay.
And thereafter we had 2 weeks. The next appointment was then. The patient had mild symptoms, and then we did another full series, and then I believe it was 5 weeks. Exactly.
And that was this summer.
Exactly. This spring, actually, in June, we started.
I don't know how it was for you, but for me it was more like only in the spring, in the summer I had more peace. Were you affected the whole summer?
The whole summer, exactly.
And you had the rest of the summer. So if you say it was in June, then it was already good?
Dann war's gut schon?
Yes. Well, the ideal was after the first injection. Before that, I think in May, it starts for me with the symptoms. And then I was, of course, already taking nasal spray and other things before. And then in June was the first oral therapy. Yes. And after that, the first 3 days were symptom-free. So it showed me that it really works. And Jürgen already informed me that several cycles would probably need it.
Okay. And now it's good for the time being, and now we'll see how it is next year?
Exactly.
What are the experiences? Is this now the first patient with hay fever with neurotherapy? No.
We have very good results with neurotherapy. The best result was with an Australian patient who actually, before he traveled, did the dietary change, so 4 weeks in advance.
Ernährungsumstellung gemacht, also 4 Wochen vorher.
That was also interesting for me. I didn't know that Australians have the same hay fever symptoms as we do here in Central Europe.
Wie wir den hier haben in Mitteleuropa.
That was also interesting for me to learn. But ultimately, it can also be attributed to the fact that people don't eat particularly well in the Western world. And after he really did the dietary change for weeks, very strictly, he then came to us. He had already, after the first neurotherapy, the symptoms were gone. So this is the so-called seconds phenomenon, according to Hünecke, the discoverer of neurotherapy.
Der Neuraltherapie.
This happens when exactly the right nerve exit point is injected with a local anesthetic. An immediate reaction occurs.
Tritt eine sofortige Reaktion ein.
That was how it was for him. It was so pronounced that the hay fever symptoms completely disappeared. He then also shortened his stay.
Sein Aufenthalt verkürzt.
2 weeks were actually planned. He ultimately stayed for 1 week. But that was really an excellent course. And you actually only have such courses when the patients cooperate 100%. That means the plant-based diet in his case, and he stuck to it 100%. And he was then with us, and we could really start the therapy.
Wir konnten dann wirklich mit der Therapie beginnen.
And that is, of course, an ideal state for doctor and patient.
So you just said the patient had already started changing their diet beforehand. How was it for you? Did you also have to follow this dietary change for a certain period before starting neurotherapy?
No, just that I spontaneously signed up. So in my case, we didn't do that. Haben wir das in meinem Fall jetzt nicht gemacht? Well, I already knew since I worked there what the dietary recommendations are, but I didn't follow it 100%. I just avoided dairy products and consumed meat in smaller amounts. Kleineren Mengen eingenommen.
Okay, good.
Gut.
So we've already heard that the change in diet is a very important aspect. Is there anything else you could recommend to a hay fever patient from your experience aside from neurotherapy?
Aus eurer Erfahrung heraus dann einem Heuschnupfenpatienten empfehlen könntet, außer eben der Neuraltherapie?
Well, there are of course many other possibilities.
Andere Möglichkeiten.
So not only working with neurotherapy now, in the end we would also have ozone treatment, autologous blood therapy. You can also apply allergy injectables according to the Herget scheme in increasing doses.
Anwenden.
So there are really many more possibilities working additionally with infusion therapy, orthomolecular, with quercetin, for example. So we've only sampled a fraction so far. But we have good symptom control under it. So it wasn't necessary to expand the therapy for Rochelle now.
So it's just tailored to the patient individually. Because it's this neurotherapy, it's not specifically hay fever, but probably other allergic dispositions as well, right?
Allergies too, but really predominantly, I would even say, in pain therapy. So most colleagues working with neurotherapy do pain therapy.
Okay, good. Yes, and then did you stay there right away? Because you said also stayed there professionally. I mean...
No, I had already been working there before.
Okay.
Exactly, a year before. But actually, I learned about it through patients and a colleague who had already done it.
All right. Oh, you were already in the clinic and struggled with your symptoms and then thought, we have something in-house that I could try. Okay, all right. So maybe we could have been a bit earlier. You could have been treated earlier. But well, wonderful. What fascinated you so much? Why did you want to work at the Biomed Center?
Yes, I was with Dr. Rao in the other clinic, working at the Paracelsus clinic. Oh, all right. I understand. I've been on the biomedical track for a while. Yeah. And what I particularly like about Schwelbrunn is that there's such a small family-like clinic where you really have time for the patients.
Yes, that's actually what many patients always miss, that the therapist can take time for their concerns because a lot is simply caused by emotional, psychological reasons.
Vieles ist eben einfach auch seelisch, psychisch
And it's nice to have someone to talk to who really listens.
Partner hat, der einen auch dafür ein offenes Ohr schenkt. Ne? Okay.
Wonderful. Then I want to first say thank you very much for such a great solution. And I've never heard of treating hay fever with neural therapy.
Therapie zu behandeln, aber
Yes, fascinating. I found another way, but it just shows that every person has their own individual path. And how you do it too, finding an individual, holistic and biological path for each patient.
Weg zu finden.
Thank you very much for your approach. That excites me and brings me joy. I hope that many people find the solution to their issues with you. Thank you very much for being here.
Thank you.
Many heartfelt thanks to you, dear viewers, for accompanying us through this conversation. And yes, hay fever, if you have someone in the family or friends, then pass the tip along.
Doch auch weiter, wenn Sie
Or if you are affected yourself, logically, then here is a great solution possibility, again, as we have heard. I wish you, on behalf of my guests, health for body, mind and soul. Stay mindful, vigilant and kind to yourself, and feel free to watch again next time. I would be pleased. Until then, goodbye.
Many thanks for watching Swiss Health Television QS24. Please also visit Wikisana, register there and watch all these broadcasts without commercial interruptions. And please also subscribe to this YouTube channel. This not only helps us, but also the further spread of our channel. Here is a selection compiled for you. Have fun, all the best, see you next time. Goodbye everyone.